Hello, everyone, and welcome to Arthritis Talks. I'm Dr. Sean Bevan, Chief Science Officer at the Arthritis Study. Most people living with arthritis remember their pain-free life before their arthritis diagnosis. They understand what exercise and getting active meant then, but don't necessarily understand what being active means now that they have arthritis. The thought of getting active again, especially when in pain, can be overwhelming, and that's what brings us here today. We're grateful that physiotherapist Trevor Donald is going to share his expertise with us and what getting active means for someone living with arthritis. Before we get started, just a few logistics. This webinar is best viewed on a laptop or desktop computer. If you have technical difficulties, please email arthritistalks@arthritis.ca for assistance. If you have a question for our presenter, you can submit it through the Q&A at the bottom middle of the screen to do so. We will try to get to as many questions as possible during the hour that we have together. You can click on the chat icon in the bottom middle of the screen to access the chat and connect with the other participants and the Arthritis Society's chat moderator. If you would like to close the chat completely, please click the red X icon to close out of the window. We are pleased to continue to provide captioning of our webinars to accommodate the diverse needs of our audience. You'll see that running along the page. Many questions we received follow similar themes, so we will address those first. And we'll get to a live Q&A at the end of the session. Before we get started, I wanted to thank our event partners, Pfizer, United Way Winnipeg, Novartis, and our other partners for their financial support of our Arthritis Talks series. Now, let's get started. A warm welcome to Trevor Donald, who is joining us today from Saskatoon, Saskatchewan. Trevor, let's get started with some of the basics. What are some of the considerations for people affected by arthritis when they are contemplating getting active?
Thanks, Sean. I'm really happy to be here today. We're really looking forward to sharing some info here over the next hour and answering some of the questions coming in. So, one of the questions we get quite often as physiotherapists is, what should I be looking at before I get active again? Obviously, with the different types of arthritis, there can be a number of things going on. And so we want to make sure that we set you up for the best chance of success that we can. And probably the best thing to remember with arthritis, particularly osteoarthritis, is that joints need activity to stay healthy. The cartilage inside the joints, the articular cartilage, has to have that movement and that activity to maintain its health. And basically, the best way to think about it is if you think of that cartilage inside the joint like a sponge, if a sponge just sits there, it stays dried up. It won't absorb anything at all. When we produce movement, what'll happen is that there's a fluid inside the joint, a normal fluid in the joint called synovial fluid. And when we move, that sponge can compress and let go, compress and let go. And as it does that, it's able to soak up some of that fluid. The cartilage doesn't have a blood supply like a lot of the other tissues in our body does. So it really relies on that sponge mechanism to get that fluid into the cartilage. And that fluid is where all the nutrients are that help keep that cartilage healthy and to keep it from wearing down. So, the low impact repetitive activity is super important because it creates that bit of a sponge mechanism. We can get that fresh fluid into the cartilage. And then by doing that over and over, it helps that fluid cycle through so that we can keep that cartilage as healthy as we can for as long as we can. Other things that we want to consider, I always tell people is, know yourself, know thyself. And a little acronym I came up with is FAST. And so the first thing we want to do is whatever activity that you're looking at doing, we need it to be enjoyable. If it's not enjoyable, your chance of success isn't as good. So if you don't like swimming, don't go swimming. If you don't like cross-country skiing or you hate the cold, then your chance of sticking with it and being successful isn't that great. And so we want to try to find those activities that are going to set you up with the best chance of success. If you like walking, then we can incorporate walking. If you like lifting some weights, we can incorporate lifting weights. So that's number one, is it's got to be something that's going to be enjoyable, because then there's a better chance you're going to continue with it long term. Second thing we want to look at is that it has to be accessible. So with that, by accessible, I mean, the equipment. So if there is equipment you need, do you have it available to you either at home, either at a gym, either at a community facility? Do you have the proper space that you want to do, particularly if you want to do some weight type training or stretching? Rural versus urban considerations. So are you an hour away from the nearest gym, for example, then the gym likely isn't a good option for you, and we're going to need to set something up at home. Depends on the time of day as well. When is going to be the best time of day for you? If you're running with kids in the morning, then maybe in the morning is not the best time. You might want to look at afternoon or potentially evening. So again, we want to make sure that we're going to be consistent with that time of day. It's going to set us up for the best success. And as well, whether we're doing it with a partner and when that partner might be accessible. So whether that's a family member or a friend, if you're planning to do some mall walking together, then you want to be able to do it when that other person is available to you. Ideally, we want to set up some kind of a structure with it. That could be, the number of days per week you're going to do it. Are we going to commit to 1 day a week, 2 days a week, 3 days a week? What type of route are we going to take? So if we're doing walking, for example, are we walking along a sidewalk? Are we walking in a park, walking in a mall? Just what components you want to have with your structure. So do you want to work on flexibility? Do you want to work on strength? Do you want to work on cardiovascular fitness, or do you want to work on balance, or a combination of all four? So again, we want to plan that out ahead of time so that we have that structure in place. And then probably most importantly is time. What time of day? This really varies from person to person. The best time of day is the time of day that you're the most limber. So a lot of folks that are dealing with arthritis aren't very limber first thing in the morning, so it tends not to be the best time of day to do it. May want to wait an hour, a couple hours, until the body starts to loosen up a little bit before we get into some of these activities. We may want to time it as well with medications. If there's certain times of medications that we're taking during the day, then again, that's probably when we're going to be feeling our best and going to be able to get the best bang for our buck as far as the exercise goes. And as well as if you normally do things like ice or heat, if you typically have a warm shower in the evening, then that might be a good time to stretch afterwards, for example, if you've just had a warm shower. So, time, very, very important. We also want to look at the type of arthritis. Again, this can vary quite a bit. And essentially what we're looking at is whether we get inflammatory pain or whether we get mechanical pain. And so the type of activity and the parameters we do with it can really depend on whether that's an inflammatory pain or a mechanical pain. So if we get more of a mechanical pain, for example, say in our knees, then we may not want to do long walks or up and down stairs, because that repeated compression on that knee probably isn't going to feel that great. If it's more of an inflammatory pain, we're going to have to do it later in the morning or even into the afternoon, because the folks with more of the inflammatory arthritises tend to be pretty stiff and sore for a good hour or two in the morning. And so, type of arthritis can definitely play into it. And then ultimately, what's your goal? Is it to improve or maintain your motion? Is it to gain some more strength? Is it just to decrease pain, improve balance, weight loss? We want to look at what those goals are, and then we can start to choose activities based on that. So if our goal is weight loss, then stretching alone isn't going to be enough. We're going to need to incorporate something else, like some kind of cardio aspect or a strengthening aspect to make sure we can meet those goals. And I know when we deal with folks a lot, we really try to dig into what's their why. What is the deeper why? Do you want to play on the floor with your grandkids? Do you want to go golfing? Do you want to go gardening? Why is it that you want to do it? And then that helps tailor a program towards that. It can be very different for golf than, say, working in the garden.
Thanks, Trevor. We know that it's extremely important for people living with arthritis to exercise safely. So how can people ensure that the exercises they are doing are safe for them?
This is a great question. This is probably the most common question we get dealing with activity with arthritis. A couple different aspects to it. Pain is always the biggest concern, because pain is our body's warning signal that something's going on, and we've got to pay attention to that pain. we're kind of past the days of no pain, no gain type idea. We got to make sure that we're respecting that pain and knowing when we can push it, when we can't push it. And so a nice way to gauge that is the traffic light system. And you'll see this vary a little bit depending on who's teaching it as far as the numbers, but this is pretty consistent, the one I've shown here. If we use a scale of 0 to 10 for pain, where 0 is no pain, 10 is take me to the emergency right now type pain, and we want to know where that pain is at any given point. So if we're doing an activity and the pain is on a 0 to 3, then we're okay to continue. It's there, we recognize it, but it's not to the point where it's really limiting us too much from the activity that we're doing, and we know that we're still in that safe level. Once we start to get into that 4 to 5 out of 10 range, now we've got to take a little bit more notice to it, because our body's starting to give us a pretty good warning that something's going on. And now we may have to modify the activity a little bit. We may have to shorten what we're doing, lighten the load a bit so that we can keep it at that 4 or 5 or less. So anything 5 and below, generally we're okay to continue with the activity that we're doing. Once we start getting into the 6, 7, 8, 9, 10, then we've got to look at some fairly serious modification or take a bit of a break, use some passive treatments like ice, heat, that sort of thing. Once we get into that 6 to 10, now we're starting to risk some tissue damage or long-term soreness. And so we've got to make sure we respect that. And so one thing that we take into consideration with the delayed pain, that with any type of activity, especially new activity that we're doing, is the activity you feel during that activity should return to normal within about 24 hours. Now, it's not to say we might not get a bit of muscle soreness, if we're, say we did an exercise class for the first time, then yeah, we might get a bit of muscle soreness that lasts a little bit longer. That sometimes it'll last up to 48 hours. But we're talking about the pain, in particular the joint pain. If it's lasting more than that 24 hours, then we probably did a little bit too much and we need to modify it a little bit.
So Trevor, what about people who are just starting to exercise or exercise again? So for those who maybe were active before their arthritis diagnosis, how would you recommend they get started exercising again?
That's a really good question. There's a few different components that we can look at here on how to get started. The first thing I want to touch on is sometimes we don't have to exercise to get started. And what I mean by that is we can look at physical activity versus exercise. So exercise is just a type of physical activity. Exercise is structured, it's repetitive. Generally there's set times a day, set number of repetitions that we do, but physical activity can be just as beneficial in a lot of cases. And physical activity is essentially any movement that your body does. So standing up off the couch is physical activity. And so where we can start to incorporate it, that, maybe instead of going into a full-blown exercise program, we can start to look at ways we can increase our physical activity. For example, do we park the car a little further out in the parking lot from the grocery store before we walk to the grocery store? Do we do our laundry in 3 loads versus 2 loads, so that we're getting a little bit of extra walking back and forth, crouching up and down, those sorts of things. So just that idea of that physical activity, doing some things around the house, doing some things around the yard, going out for a little bit of a walk. Sometimes that can be that nice buffer zone between doing nothing to going into a full-blown exercise program. And it kind of helps build up that tolerance a little bit before we actually get into somewhat of the exercise program. So some different examples of physical activity could be something as simple as different games, sports, stuff like golf, pickleball, those types of ideas. Even walking, as I touched on. Nordic poles, for example, can be quite beneficial with the walking. They're a nice way that you can unload the spine and some of the joints by using the Nordic poles to help as you walk along. Cycling, swimming, some of the aquasize classes and that are out there. Even dancing, turn some music on in the house, start dancing a little bit. That's physical activity and can have some huge, not only physical benefits, but mental and emotional as well. And then as we're getting started, again, we always want to consider, are we going to do it by ourselves or are we going to do it with somebody else? So if we've decided that we're going to do it by ourselves, what's that look like? Are we going to do it at home, or are we going to go to a gym, for example, to do it? And so again, deciding what's going to be the best fit for you. If you hate going to the gym, don't go to the gym, because again, it's likely not going to last that long. Then we want to set you up for the best success that we can. If we tend to do better in a group situation, which a lot of us do, then we can look at, for example, doing something with a partner. Whether we go mall walking with a friend of ours, even just our neighbor, same idea, we go for a walk, go to an aquafit class with a friend. There's lots of different support groups out there that run different exercise classes. There's some more structured actual arthritis exercise classes. The one I'm most familiar with is the GLAD program for hip and knee arthritis. There's facilities all across the country that run the GLAD program, which is really, really effective for hip and knee arthritis. And even checking in with your local community groups, a lot of them will run different arthritis classes as well, just to keep people active. And what it boils down to is the general recommendation for activity is that we want to shoot for about 150 minutes per week of moderate level activity. And ideally, this should be about 30 minutes per day. So it doesn't necessarily have to be every day. Sometimes the body just needs a break, and we can take a day or two off during the week. But the general idea is we want to shoot for about 30 minutes of, again, this is of activity per day, not necessarily exercise per day. At least twice a week, we want those bouts to be 20 minutes long, so that we do get that little bit of a sustained effect, whether it's a 20-minute walk, whether we're dancing for 20 minutes. Again, a lot of classes are minimum 20 minutes long, so those fit into there nicely. And the really nice thing is that it doesn't have to be all at once. So that 30 minutes can be broken up into 10-minute bouts. So if, for example, your knees are sore enough that you can't walk for half an hour at a time, that's fine. We can break it up into, say, 3 10-minute bouts during the day, and we get the same overall effect. We still get that 30 minutes total, but we can break it up so we're not hitting that same threshold of soreness throughout the day. When we're looking at moderate intensity, there's a few different ways you can measure moderate intensity. The one I like to use is something called the talk test. And so what this is that if you're doing an activity, you're starting to breathe a little hard, but you could still carry on a conversation with the person beside you. You wouldn't be able to sing to them because you're starting to lose your breath a little bit, not being able to get that extra air in, but you'd be able to carry on a conversation with them. And that gives you a pretty good idea of where you're at as far as moderate level.
So Trevor, this is a question that I know we received in advance, and I already see several people asking it this evening in the Q&A. So what about when people are actually going through a flare? What would you recommend in terms of physical activity?
Yeah, and again, when we're dealing with the different types of arthritis, this is a huge consideration, because a lot of them, for example, rheumatoid arthritis, flares can be relatively common. And again, we've got to respect the flare and what's happening during the flare. And so essentially what it comes down to is that we've got 3 options. We can continue what we're doing, we can stop what we're doing, or we can modify it. By continuing it, there's a pretty good chance that pain level is going to get to a higher number out of 10 than what we like as we're going through the flare. So continuing is probably not the greatest option. If we stop, we're going to lose any of those benefits of activity, particularly strength benefits. I believe the stats are something like we lose 3 to 5% of our strength per day with inactivity. So we want to maintain as much of that as we can. So usually the best option is to modify, and that might be we do it less frequently. So maybe we do our exercises less times per day or less times per week. We do less of it, for example, like less repetitions, less distance, or we do something different. So if we find that lifting weights is bothering our hands, then we can maybe switch it up to where we're using more, say, Theraband or elastic tubing, or looking at a different option where we can still continue to be active but not having to stop completely. Probably the biggest thing to remember is that when people are going through a flare, in the vast majority of cases, it's not causing damage. It's just flared up. The pain has flared up, the inflammation has flared up, but usually we're not causing tissue damage. So we're okay to continue some activity. again, we just got to respect that pain and make sure we keep it at a reasonable level. One of the main goals when we're going through a flare is that we want to make sure that we can maintain that mobility. So we don't want those joints to stiffen up, because quite often they'll take a while to try to loosen back up again. And so if it's the acute stage of a flare, so we're kind of at the height of the flare, everything's firing away there, then we want to deal more with passive range of motion. So maybe we use, for example, our other hand to take our fingers and our wrist through range of motion. Because if we do it actively, sometimes that can add a little bit of joint compression. So either we use one of our other limbs to help out, or we ask a partner to help out, or this is where some of the passive treatments can come in, where someone else can move the joints for you so that we can maintain that motion. As things start to settle down and we get more into that subacute phase, now we can start to add a little bit of a gentle pressure or a gentle stretch at the end of the range of motion, so that we can keep that joint capsule stretched out and as mobile as it should be. But if we try to do that when it's really acute, usually it just fires it up even more. So generally the passive range of motion is enough just to maintain that mobility. Other things to consider: medications. Again, this is where you need to chat with your doctor to find out what's the best option for you. If it's something like the over-the-counter anti-inflammatories, Aleve, Advil, naproxen, those sorts of things, they might be an option to help control some of the inflammation that's happening. Tylenol is the safest and probably the most recommended in most conditions and most situations. That's an option to help us control some of the pain. Or we can look at some different topical options, such as the Voltaren rubs and a few of the other ones that are out there, which again can have some benefit as far as that pain relief effect, as well as the anti-inflammatory effect. And or any prescription. If your physician has prescribed any prescription anti-inflammatories, prescription painkillers, then those are an option as well to help keep that flare under control. On the more mechanical end of it, we could look at any different aids. So aids can include a lot of different things. Braces would be an example. Wrist braces, knee braces, ankle braces, thumb braces, finger braces, any of those sorts of things that could help support that joint just to get it through that flare and get it out of that acute phase sooner, so we can get it calmed down quicker. Aids can include some of the walking aids. Again, Nordic poles, canes, walkers, those sorts of things. Again, they can just help unload that joint enough to give it a break, over the course of a week, 2 weeks, whatever the case might be that we need to get that joint to settle down. And then also we could look at different passive treatments, whether it's something like physiotherapy, massage therapy, chiropractic, acupuncture. Those are some of the more main ones that are out there. Those types of things, again, just as that extra level of treatment to get that flare back under control quicker than it would just on its own.
So when would you advise, when is it appropriate for people to take their physical activity to the next level?
So the way I usually like to explain it, we use this in the business world as well, but it's we call it GWC. You get it, you want it, and you have the capacity to do it. And so how that works in conjunction with progressing exercise, for the get it part of it is you really need to understand it and have a good understanding of, how to progress it safely. Do we want to increase by 10%? Do we want to increase by 20%? Do we want to double it? We have to have a really good handle on that. The general rule of thumb is we want to be around 10% per week is usually lots. Again, that can vary a little bit depending on what we're doing, but that's usually a fairly safe rule to follow. And it may be we increase the distance that we walk. It might be that we increase the speed that we walk. Could be we increase the resistance. For example, we could start to walk uphill instead of on a flat surface. And we don't need to make a lot of major changes in most cases. We can just start to play with some of those variables. The other part of get it is, if it's getting too easy, then it probably is time to progress. If you do the activity and you're not getting anywhere near that moderate level, then we probably can bump it up a little bit, as long as the pain has been under control. Particularly if you haven't done any progression for a while. One of the tricks with exercise is that exercise is meant to be progressed. if we do the same thing all the time forever, then we can't expect any improvement. We need to be able to challenge the body a bit. And as we challenge the body, then it'll respond by improving. So, every 8 weeks, for example, we want to progress that activity so that we can start to challenge the body and make those improvements. Now, the caveat to that would be, if we are going through a flare or the pain isn't under control, then we can't progress yet. We've got to make sure that's under control before we do progress. For the aspect of want it, this really comes down to, are you comfortable progressing? If you're not comfortable, if we don't have the mindset there that we're not comfortable progressing, that's fine. Continue on, until we are comfortable, or get some help to progress it, whether it's a exercise professional, physio doctor, anybody along those realms that can help you out with the progression. So that's the wanted part of it. And then the capacity to do it can involve a number of different things. For example, if the current activity is not challenging enough and we're able to progress that activity. So for example, that activity then has the capacity that we can increase it. Again, the pain has to be controlled, so our body has to have the capacity to do it. If the pain isn't under control, then our body doesn't have the capacity to increase anymore. Do we have the time to do it? So, for example, if you want to walk longer, do you have the time to do it? You have to get the kids to school. Do we have enough daylight? This time of year, that's definitely a consideration as it's getting darker earlier and earlier. Do we have the space to do it? For example, if you're doing different weight training exercises or that at home, do we have the proper space that you can progress it? And do we have the equipment? Are we going to need more weights? Are we going to need some elastics? If we're doing hand exercise, do we have the tools that we want to increase the hand exercises? So again, lots of different considerations as far as the capacity to do it. As long as we have the equipment, we have the space, we have the time, we have the financial resources, then we've got the capacity to progress.
So thank you very much for sharing your expertise with us tonight, Trevor. I think that our attendees have found many of the tips very valuable. Before we get to some of the live Q&A from this evening, do you have any final thoughts or recommendations for our viewers?
I would say probably just in summary of what we've talked about, the biggest take-home message is that low-impact activity is safe, and in fact, it's necessary. Those joints, that joint cartilage really needs that movement to stay healthy. That's what keeps it from degenerating faster and wearing down faster. So that, there's sort of that old notion of wear and tear. So if we do more activity, we're going to wear the joint down quicker. And that's not necessarily true. We need that low impact activity to keep that cartilage healthy, to keep that sponge mechanism working so we can get that fluid and nutrients through the cartilage. And then looking at a flare, like I said, with arthritis, flares are going to happen. They're going to come and go. A lot of times they come at an unexpected time. And the key is to manage it, not quit. Because as soon as we quit, then it takes us back down to square one, and we're having to build up from that lower level again. Always best if we can modify, whether we do it differently, whether we do a little less, different activities, however we can modify it that still allows us to be active, then that's super important. And that take-home message again, that in most cases, a flare isn't causing damage. It's causing pain, it's causing inflammation, but it's not necessarily causing further damage to that joint.
Great thoughts, thank you. Not surprisingly, we've had a number of questions come in this evening, so I'm just going to get started. The first here relates to weight-bearing versus not weight-bearing exercises. So do you have any perspective about one is better or worse for people living with arthritis?
Yeah, part of it can depend on the state of the joint and whether it's going full of flare or not. For the most part, we prefer weight-bearing exercises because they stimulate that sponge mechanism better that I was speaking about. The weight-bearing can help compress that sponge and get that fluid moving through there a little bit better. Now, if we've got a joint that is in a bit of a flare, we may need to go away from the weight-bearing exercises So that this is the idea of modifying it so that we can still do some of the strengthening, we can still do some of the flexibility, um, and get some of the benefits of that, but we give that joint a chance to calm down. But as a general rule, we like more the weight bearing activities. It involves more muscle contraction. We get more muscles working at the same time, so we get a lot of muscular benefit. And especially in the lower body with the weight bearing exercises, now we can start to incorporate balance and that control of the joints, which is often a huge issue too, especially as those joints start to get some structural changes in the ligaments and some of the tissues around there. Then balance becomes even more important.
Okay. What about exercises for specific areas of the body? So in particular, we have people asking about exercises you would recommend for the shoulder, the neck, and hands.
Yeah, part of it will depend on what's going on with those joints, what the mobility is like. Um, with any of them, for me, first priority is always mobility. We want to make sure that that joint is moving through as much of a range of motion as we can. Then, for example, if we have two joint surfaces, if they're only moving this much on each other, they're probably going to wear down a lot faster than if we can spread that movement out over a bigger area. So the more we can spread that movement out throughout the joint, then the slower it's going to wear down certain parts of that joint. Especially with the upper body, neck, shoulder, up in that area, posture is such a huge consideration. And so a lot of times where we'll start people is some stretches where we're stretching through the front of the chest or the pectoral muscles. So for example, with the arms up on a door frame and taking a bit of a step through the door frame just to open up that chest. And that can really take a lot of tension off of those shoulder muscles, neck muscles, even upper back muscles. As we get into the hands and the wrists, same thing, we always want to consider motion. So we want to make sure we're taking those hands and wrists through the motion. Quite often I'll do something called tendon gliding exercises where we have folks do different types of grips. So we have them try to curl their fingers up as much as they can curl them up. Then we have them curl into like more of a normal fist. And then we have them reach towards their wrist. And so it just starts to move different joints within the fingers. Real nice, easy, safe exercises, kind of those three different versions of it. But yeah, mobility is a big consideration. And then strengthening, we got to be a little bit more careful about depending on what type of arthritis we're dealing with and which joints are affected. But generally, as a general rule, things like squeeze balls, those kinds of things can be beneficial. A lot of times I'll tell people just to do dishes because the warmth of the water is really good for those joints in the hands and the wrists. And as you're moving and manipulating in the water, you can get a bit of that strengthening effect as you're lifting some of the plates and the utensils, but the heat can have such a huge benefit.
What about for people who are experiencing pain and arthritis in multiple joints? The question here is about, do you have any recommendation about where they should focus their attention first with respect to trying to exercise or increase the mobility in those joints?
Yeah, usually where we'll start, like when I see people in clinic, usually where we'll start is the most affected joints. And that's the thing with a lot of these different types of arthritis is they very rarely affect one joint or two joints. Quite often it's, multiple areas. And so, when I'm doing a history with them, generally I'll say, okay, where's the worst area? And quite often the second worst area is very close to the worst area. And so we can start to work two or three of them at the same time. Because again, it can get a little daunting trying to take them all on at the same time. And then if we're doing an activity and it flares up one joint, but not the other 8, then we have to modify or limit the activity because of the one, which means the other 8 don't get the benefit of it. And so, by kind of picking them off 1 or 2 joints at a time, then we can start to build from there. And so I'm a big fan of multi-joint exercises where we have a lot of joints moving at once. So examples of that are chair squats, for example, where we're getting up and down out of a chair. Even wall push-ups where we're doing a push-up off the wall. So we have wrists moving, elbows moving, shoulders moving, where we get lots of joints moving at once. And so there is ways we can strengthen and work on a lot of those joints at the same time. But generally, I usually get people to start with the ones that are the most affected.
Okay. You mentioned in your slides some pain medications that people might be on. Do you have any recommendation, or are there any considerations for people in terms of the timing of when they might take those medications and when they might be doing exercises?
Yeah, that's a really good question. With a lot of those medications, what we'll recommend before exercise is to take the medication before exercise, um, unless it's like a prescription painkiller, for example. And so, any of the over-the-counter ones, the Tylenols, the anti-inflammatories, and that they're usually good to take before exercise, because in that way we can control that pain and that inflammation before we do the activity, and the medication will last long enough that we'll still get the effect after the activity. As we get into some of the more heavier stuff, like some of those prescription painkillers, the narcotics, now we got to be a little bit careful, because they can affect our coordination. They can affect the judgment a little bit, and it starts to become a little bit of a safety concern, especially if we're doing some high level balance exercises, or if we're dealing with some weights, for example. Then those I may be more inclined to take afterwards, or at least a few hours before, so we're not getting that heavy effect where it might affect some of our alertness while we're doing the exercise.
Makes sense, I think. I think we have a couple of sort of does it count kind of questions. So you did a nice job of laying out some physical activity guidelines in terms of the length of time people should be targeting. So in particular, someone's asking about golfing. Would you consider that an effective form of physical activity? Somebody here is walking with a walker, so assisted support. Would you consider that in those kinds of exercise targets?
Yeah, golfing can be great. Most of us, when we golf, swing a lot. And so it can be a great activity, because it can really work on our flexibility, particularly through our spine, because there's so much rotation involved in golf, and it's so repetitive, that it can really help out with some of the rotation in our spine, some of the movement in our shoulders, in the hips in particular. With golf, there's a lot of walking, and so we get some of that cardiovascular benefits. There's a balance component to it. There's a bit of a strength component to it. It's multi-joint, as I talked about some of those multi-joint exercises where, with the swing, we're having to move a lot of joints at once. Even just putting the ball on the tee or picking it up off the ground, again, lots of benefit to that. Now, with it, there can be some drawbacks depending. The most common injury in golf is low back pain. So we've got to be a little bit careful, because there's so much rotation with it, to make sure that spine is able to do the rotation. But as far as an activity, golf generally is a really good activity that we can do. The walking with the walker is fantastic. I recommend it all the time. It's sort of that old adage that any walking is better than no walking, whether it's 2 feet, 20 feet, 200 feet, 2 miles. What that walker does is lets us walk, because we wouldn't be able to do it as much without the walker. So absolutely, if it involves using a cane or a walker or Nordic poles, yeah, absolutely using them as much as you can. Especially a lot of the fold-up walkers will have a little seat on them as well, so that if you do need to take a break, you've got the seat right there. You can sit, take a load off for a minute or two, and then get back at it.
So we have some people in our audience who are waiting for joint replacement surgery. We've had a couple mention hips and knees. So are there particular exercises you would recommend for people in that situation?
Yeah, again, the one I'm most familiar with is the GLAD program. It's GLA:D, and so it's a hip and knee arthritis exercise program that was developed in Denmark, and then it was brought over to Canada. I believe it was 2015 that they brought it over to Canada. And the goal of the GLAD program is neuromuscular exercises, and so it involves a fair bit of strengthening, but it really works on control. So that the control of the joint, which involves a lot of balance, and with that we get a lot of muscles working at the same time around those joints. And it's a research-based program that has an ongoing research component to it, and has some tremendous results. And so the types of exercises that are involved in the GLAD program can be great for hip and knee arthritis. There's 4 different stations that have 2 different exercises, and so there'll be some Theraband exercises for the hip and knee. There is some step ups, and we do different levels of the step ups. There's variations of squats. There's a balance exercise where we slide a towel on the floor. There's some core strengthening in there, and they're really variable. The nice thing is they give us lots of freedom to be able to modify those exercises to the level of the person that's doing it. And so those type of weight bearing, repetitive, low impact exercises are great for any joint, particularly hips and knees. I know they are working on a lower back one as well. I believe it's being piloted at the University of Alberta right now. So that should be coming along here in the next few years. And then the same principles apply to upper body. If we're waiting for a shoulder replacement, for example, we can bring in either Theraband or free weight exercises to work on the strength. We can do some load bearing, weight bearing exercises like wall push-ups or push-ups off of a countertop. Those types of things where we can actually get some weight going through the joint to stimulate that sponge mechanism.
We had someone ask about further explanation of the GLAD program, so thank you. I think you've answered that in advance. Similarly now, post-surgery, and maybe it's a similar answer, but are there particular recommended exercises following surgery?
Yeah, with pretty much any surgery, the surgical team or the physio that sees you in hospital will give exercises to do post-operatively. Always the first goal is to get some of that mobility back, which is to keep the joints from stiffening up, as well as prevent complications like clots in the legs and those sorts of things. After any surgery, they will get a series of exercises, and most surgeries have a particular protocol we'll follow afterwards. But general guidelines are within the first 6 weeks after a surgery. Usually it's getting some of that mobility back. Once we get to about that 6-week point, then we can start to incorporate more and more strengthening exercises. As the strength starts to improve, then we can get a little bit more into the functional exercises, which are more similar to what you do day to day. Things like getting in and out of bed, getting up and down off the floor, getting in and out of a chair, out of a car, those sorts of things. And so depending on the surgery, the exercises will vary, but that's usually the process that'll follow with pretty much any surgery.
Okay. We have someone here asking about Therabands that you've mentioned a couple times now, and the question is, how can they be used without causing pain to people's hands?
Yeah, it's a good question because they are an elastic, either a band or a tubing, like a little rope kind of material, and so they can involve some gripping with them. Usually what I'll do with Theraband is I'll just tie a loop in the end of it, so that we've got this loop in the end, and then you can just stick your hand through it and loop it around your wrist. And so we can do different exercises where the hand doesn't have to be involved at all. The Theraband's just looped around the wrist. So that's one way to use it. Or if we don't have access to the Theraband or the elastics, we can do the same thing with something like a shopping bag, where we can put some weights or soup cans or whatever we got at home inside of a shopping bag, and again, just loop it over top of the wrist, and then we can do whatever movements we need to do.
Okay, so I think this is coming from someone who used to use public swimming pools quite frequently before the pandemic, and really the question boils down to, what are alternatives for aquafit kind of exercises that you would recommend for people?
Yeah, the water exercises are great because it's the buoyancy of the water can really take the pressure off of the joints. And as I mentioned before, with doing dishes, a lot of time the warmth of the water can be of huge benefit as well, because sort of that old adage that everything moves better when it's warm. But like I said, with some of the COVID restrictions, and we have to book time now to go to a lot of the aquatic facilities that is just not available. And so generally what we'd want to look for instead is another type of low impact activity. Probably the most common one that comes to mind would be cycling, whether it's a stationary bike, or if you're in areas of the country like I don't live in, where you can bike year round, and biking can be a great one. because it's, we can still get a lot of resistance, a lot of cardiovascular benefit without having the impact like with walking or stepping type exercises. Another one we could look at would be something like an elliptical. There is a little bit of impact with it, but it's not to the same extent as say, for example, walking would be. And as we approach the winter months here, something like cross-country skiing can actually be quite good, because again, it's more of a back and forth movement versus a pounding movement where we're taking a lot of impact through the joints. So, cycling is usually the most common, but there is some of these other options out there as well. Cycling can be anything from a recumbent bike all the way up to, there's a thing called QB, which is like a little pedal apparatus that you can basically put down by your chair, and you just pedal it sitting in your chair. And then there's a bunch of variations of that, the different pedal ergometers and that you can get to cycle without having to actually have a bike.
I don't think I asked you about these earlier, and so a few people are asking about exercises for ankles and the lower back. Not together necessarily.
Yeah. So yeah, with ankles, usually one of the biggest considerations with ankles is the calf muscles. In a lot of us, those calf muscles get pretty tight, and then they can really limit that ankle mobility. So, one of the ones we'd often look at would be calf stretches, and there's a few different variations of those. Even something as simple as ankle circles, where you just put your foot up onto your toe, and then you just rotate your ankle around in a circle, because that can give us some of that mobility at the ankle joint. With the ankles, we always want to consider balance, because that's where a lot of our balance sense comes from our ankles. And so sometimes I'll even have people, for example, just stand on a pillow with one foot, because the pillow's got a little bit of give to it. And so if we stand on it with that one foot, it'll shake and quiver a little bit as your ankle adjusts, but it can be a really, really good strength, really good balance exercise for ankles. Lower back, that's definitely the most common thing we see on a day-to-day basis is low back pain. And again, mobility is a huge consideration. We want to make sure that we've got some of that mobility, even for something as simple as rolling over in bed, that if our legs go one direction and our body isn't necessarily moving in sync with it, then we've got to have the motion available in the back to be able to do that. And so there's literally thousands of lower back exercises. Some of the more common ones I'll use will be, for example, laying on your back with your knees bent, and then just let both knees fall to the same side. Just gently hold it 5-10 seconds, let them fall to the other side, hold 5-10 seconds. So it's almost like a windshield wiper going back and forth. And that can be quite nice just to loosen up the lower back a little bit. Pulling your knees up to your chest is usually a good one. And then as far as strengthening of the lower back, lots of different exercises. Again, even just something as simple as chair squats, where we get up and down out of a chair, involves a surprising amount of back strength and core muscle strength. So those can be beneficial as well.
I have to ask about feet as well, because there are many people now adding that to the Q&A. So same question, exercises for feet.
For feet, again, the calf muscles are a big consideration. We always want to make sure we consider the calf muscles. With feet problems, a lot of ones involve what we call the first ray, which is the big toe and everything that extends up in a line from the big toe. And so we want to make sure we get that big toe involved. And sometimes when I have people stretching a calf muscle, I'll have them elevate their big toe on like a pair of rolled up socks or a little book or something like that, just so we get that extra little bit of stretch through the bottom of the big toe. We can roll a tennis ball underneath our feet. So rolling a tennis ball under the foot can be a quite useful massage technique for the bottom of the feet, because it can get surprisingly tight and sore in the bottom of a foot. Just be careful, because through the arch it can get pretty tender in there at times, but rolling a ball through there can be a nice exercise to release a lot of muscle tension, as well as the foot has to form to the ball, so it'll kind of make a dome over top of the ball, which can help with some of those joints through the mid part of the foot. Yeah, those probably be two of the more common ones. And then beyond that, as we get into specifics, we'd probably look at some different ones as far as rolling exercises onto the feet, but we want to make sure we know what we're dealing with before we get into those.
Okay. Any difference between walking on a treadmill or outside?
Yes, there's quite a bit of difference. With a treadmill, there's actual different mechanisms that happen in the foot walking on a treadmill than walking outside. And without overcomplicating it, it's the reason being is that with a treadmill, it's moving underneath of you, versus with walking outside, you're moving over top of the ground. And so there's a little bit of different muscle action, a little bit of different things that happen in the foot. The nice thing with walking outside is that we can change that surface. We can go from a cement sidewalk to an asphalt street to a grass park, to a sandy playground. We've got lots of different options of surfaces, and there's pros and cons to each of those. The benefit with a treadmill is that it's easy to add elevation if we want. We can speed it up really quickly if we want. We don't have to worry about traffic, up and down curbs, those sorts of things. So there is a difference. Even amongst treadmills, there's lots of difference. Some of them have what's called a flex deck, where they've got a lot more give to them, so there's a lot less impact, versus some of the more traditional ones that have a solid state deck where there's really no give to it as you're walking on it. So that'll create a little bit more impact through some of those lower body joints.
Great answer. I think this one maybe is mostly just clarification. And so the question is, should you stop exercising during a flare? So I'll just let you clarify that maybe.
Yeah, definitely not. The best thing is modify. And again, number one goal is to maintain the mobility. And whether that's having somebody else help you out with maintaining the mobility by doing a little bit of movement for you, or just doing some really gentle range of motion exercises. But if we've put that work into gaining the strength and gaining the balance and that mobility, then we don't want to lose it during that flare. So there's lots of different ways we can modify our activity so that we can still do things but manage the flare at the same time.
And do you need a doctor's referral either to see a physiotherapist for arthritis symptoms or for the GLAD program that you've mentioned this evening?
No, physiotherapy is a direct access profession. So we, especially in the private setting like what we work in, we don't need a doctor's referral. The only case where people might need one is if they're planning to submit it through an insurance plan. Then there is still some insurance plans out there that will require a doctor's referral before they'll cover it. But even those are getting less and less. A lot of them now are just allowing people to do direct access with us. Same for the GLAD program. Any of the facilities I know of, I don't think you need a referral for it. It's just a matter of getting a hold of the facility and saying, hey, I'm interested in this GLAD program. Can I participate? GLAD has a really good website. They have a list of all the locations across Canada on their website. Some provinces have more than others, so it just depends on the province that you're living in as to how much is available.
That was another question actually that came up about access to the GLAD program. So it sounds like people have the ability to access it themselves through the online resources.
Yeah, they can search out the facilities on the GLAD website, and all the contact information for the facilities is on there. So for example, like with our clinic, our address, our phone number, everything is on there. And so they can just contact the facility directly, and then they can let them know when they're running their next group and what all the details are as far as getting people started.
Okay. What about fibromyalgia? Does everything that we've spoken about this evening, would it relate the same way, broadly speaking, to fibromyalgia, or are there different considerations there?
Yeah, same idea with fibromyalgia. As a general rule, we won't get as much of the inflammatory issue as we will with some of the different types of arthritis. So we can pretty much always continue with the activity. Again, same rules apply that we may need to modify it. If there's certain parts of the body that are starting to flare up more than others, then we may need to modify. With that increased pain, there can be a real drain on energy, and fatigue can be a huge issue. So we need to be able to manage that. Make sure we're getting the proper nutrition, proper hydration, proper amount of sleep. And again, we're using the medications as they're available to us, and what they're intended for, so that we can manage the best way we can that way. But yeah, I would say almost everything we talked about today would apply to fibromyalgia as well. Outside of, like I said, there's usually not as big of an inflammatory component that we have to worry about.
Okay. A few people are asking, is there a cost related to the GLAD program?
That'll depend on the facility. I know some of them will get funding through different provincial organizations or grants that they have where they can run it at no cost. And then there is other facilities that do need to run it at a cost. A lot of them are run by physiotherapists, and so you can generally submit it to your physiotherapy benefits through your health plan. Same thing, that some of them have kinesiologists running it, or chiropractors, different health professionals. So yeah, it's best just to check with the individual facility to see if they do have funding for it. If they don't, how do they invoice it, and are you eligible to submit it to an organization for reimbursement?
Okay. And I just want to loop back to something that you just talked about with respect to fatigue. And a number of people are asking, generally speaking, how would people balance the fatigue and the desire to exercise? Any recommendations there?
Yeah, again, part of it goes back to that idea of knowing yourself. So does that fatigue vary during the day? And so if it does, then ideally what we want to do is we want to try to incorporate that activity or that exercise at that time of day where we have the least amount of fatigue, or close to the least amount of fatigue. And there's times that if, we're having just a really rough day where we got no energy, there's no shame in saying, you know what, I'm going to do it tomorrow instead. But the key is to do it tomorrow. We don't want to string together a bunch of those days in a row. Sometimes, yeah, we just got to be reasonable, give ourselves a break, give the body a chance for recovery. But a big part of it is just knowing yourself, and when is the energy available that you can do it, and remembering we can break it up into bouts. A lot of times it only needs to be 10 minutes at a time. We don't have to do an hour-long walk or lift weights for 45 minutes. We can break it up into those 10-minute spurts and still get lots of benefit out of it.
So I think we've run out of time, Trevor, but thank you so much for sharing your thoughts with us this evening. We would like to take a few moments to get the audience's feedback on today's presentation. So for those of you on a laptop or a desktop computer, you will see a poll question come up on your screen with answer options. So please do click on the response that best reflects your thoughts. Quite simply, did you find the information in today's webinar helpful to you? We will also be sending out an evaluation form when we send out the recording. So if you aren't able to access the poll question, you'll have the opportunity to give us feedback at that time. And we use the survey feedback to shape our Arthritis Talks webinar. So we really do value your feedback. Thank you. Once again, we are grateful to our partners, Pfizer, Novartis, and United Way Winnipeg, for their support of this event. And we'll also be back in November for Arthritis Talks, Coping with Chronic Pain and Fatigue. So stay tuned in your inbox for details on that event. This concludes Arthritis Talks, how to get active again to help manage arthritis. On behalf of all of us, thank you for joining us today, and please stay well.